Hi, it's Diane Goodmanson, Nurse Practitioner here. I had put up a post on social media asking, hey, does anybody out there have any questions about our healthcare system? Any particular concerns about it that you'd like answered? Any questions about maybe what a nurse practitioner is? And I just posed the question on social media, and I've had a lot of responses through private messaging asking me several questions, and I'm trying to put together some answers. And so the first question I got was, Diane, why did you put together a private clinic? Like, what was it that motivated you to do that? Why did you do that? And does that work, considering that our healthcare system is typically free? So why would people want to pay for healthcare services? So the answer to this question is actually very long, but I'll try to give you the short version. So I worked in the healthcare system now for over 25 years, and 15 of those has been as a nurse practitioner in primary care mostly, although I've done some work in emergency room, teen clinic, long-term care as well, and also in menopause. And what I'll have to say is it seemed that as I was moving from job to job, it seemed like I was always hitting a wall. It's like I would always we got to do better for patients. We need to be able to be creative to find better solutions for providing medical care for people. And it seemed like working inside of a union position was very limiting, because it seemed like that I was always hitting the ceiling or wanting to bust apart the walls, saying like, gosh, we should be able to do things much better. But there was limitations and restrictions, and even though you wanted to make improvements, there was always somebody in the background or as your supervisor saying, no, 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 we cannot do that. So as a provider working in the healthcare system, it was very frustrating for me. And so moving on to from the patient's perspective, I found as a patient myself and for my family that getting access to healthcare, to good healthcare was challenging. It just seemed like we're being rushed through appointments, and it just seemed like you couldn't make a good connection with a provider like it used to be, that if you had a primary care provider, you would have a real connection with that person. They would know who you are, they'd have a good understanding about your health, and you just felt like that was somebody that you could go to. And it seemed like that whole system was becoming more and more eroded as time went on. And sort of the straw that broke the camel's back for me was I took a position in a quick care clinic, and what I found was people were going from walk-in to walk-in to walk-in quite often, and more often than I even knew was happening, and looking for answers, and quite often only getting maybe a few minutes of service and no really good explanations about what's going on or what would the next steps be, or like what could this be. They would often just come with a prescription. And so they would come into the quick care sometimes with 2 or 3 different prescriptions. Maybe they had been to 3 or 4 different places, and they're often very confused, sort of about like, what is my diagnosis? What do I even take? Like, what do I do next? And so it just seemed like my experience was the system was just becoming frustrating for both myself and for the patients. And so what I thought was, hey, you know what? The pain of sticking around inside the public system for me is way more pain than it would be maybe if I just started myself, started a private service. And you know what? I'm not even sure how many patients would use it, considering that it's private pay, but let's give it a shot and see how it goes. And I was super shocked, because within those first 3 to 5 months, I had more patients that I could handle. The phone calls, the quantities of requests that I had for second opinions and help and advocacy and all that. And I was getting patients right from sick newborns all the way to, elderly who had a hard time getting out, or special needs clients. And so the volume of patients that I was taking on was actually overwhelming in number. And so I started looking for other nurse practitioners who were interested in doing something similar to help me out, because it was becoming almost impossible to meet the need. And so the question really is, why did I start a private clinic? Well, you can see there's many factors. I wasn't happy. I could see patients weren't happy. And you know what? Now that I'm outside of the system, I can actually see very clearly the gaps that are there in the system. So it's like, there needs to be somebody outside the system that can have a 30,000-foot view and look in and see the kind of gaps that are actually in our healthcare system that somebody needs to tap into. Like, I'll just give you some examples. So number one is you have patients with complex needs. They may have like multiple diagnoses. Maybe they're on, multiple medications. There's no way that a regular clinic with those very, very short visits is going to be able to properly manage those patients. And also clients with special needs have a hard time going out to clinics. And so we find that providing the service at the house, because we do house calls on a private basis, is very effective to manage those clients. Also, I'm finding that patients who have chronic pain syndromes, maybe it's chronic non-cancer pain, who maybe have been either started on opiates or have been on opiates a very long time, or who feel judged or labeled by the system and have a hard time finding a primary care provider who actually wants to look after them as a patient and not make the fact that they're on opiate therapies hey, you're on opiates, so we don't want you as a patient. And there's far too much of that going on. And so we're trying to address that by, bringing patients in who have chronic pain, and also implementing very strict and stringent sort of de-prescribing programs to help people get the proper pain medication, and then help them to taper off opiates, which is ultimately better for their health in the long run. And also there's numerous other types of patients who are benefiting from our service, who find it is just so worth paying for. For example, people that are disabled, who, let's say, require special transportation or supervision to go out to appointments. Quite often it's cheaper to hire us to come in and do the medical care at home than it is to hire out, attendants and transportation and things like that to actually go out to appointments. And sometimes those appointments are very inefficient too. You might go see the provider, and then you have to go take transportation to go to a lab, and then you have to go back to the clinic, and it just ends up being a lot of waiting and a lot of inefficiencies. So part of what we offer as Nurse Practitioner on Wheels is we provide full service medical care at your house, and we also draw blood work, do the tests, do the assessments, and things like that. And we can refer to specialists. We can arrange for things like ultrasounds and CT scans or whatever happens to be appropriate for your medical care. So in the big picture, I know the question was originally, why did you start the service? But you can see how it's so complicated. A person could go on numerous tangents with regards to all the different things we've been doing over the last 3 years. So it's been quite satisfying for me, and I know we have a lot of happy patients with our service, and who are more than happy to pay for the service because they feel that they get a very thorough service, they get a very caring service, and we build a very solid and good therapeutic relationship with our patients. And I feel that a lot of times that is part of what patients crave, is they really want to feel like they as a person really matter and that they're not just a number. So in the big picture, we have a lot of happy patients, and the practitioners that we bring in to work for us as well are very happy to be able to provide true patient-centered care. And we also have make the best use of technology that we can to make this service as efficient and as effective as possible as we go along. So anyways, I hope that answers your question, and I will see you on the next video when I answer the next question.